So for me, it's really awesome because at Casito, I got all of the training materials that I need. So all the mannequins, all the replacement parts, all the handbooks. I also can give them the e-cards that they have to prove for their certification, all for free. And so they offer grant opportunities that basically refunds me to allow them to take the training for free, be certified, and then they're good for 2 years. So then they would contact me. I would set up a time that works best on both my schedule and their schedule. So for instance, the one in Erie, I actually went to them and we did it in their daycare center, which was awesome. I was able to train 8 people in one big setting. So one full day instead of having to break it apart and have them close doors multiple days in a row.
K-State research and extension agents and specialists from across the state were on the Kansas State University campus in Manhattan, October 24th through the 26th for annual conference. During the conference, I was able to visit with 3 agents from the Southwind District about some of the community conversations that they've been having in the counties they serve, Allen, Bourbon, Neosho, and Woodson, on today's Sound Living, facilitating community conversations. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. One goal of Extension is to provide technical assistance and evidence-based programs to those wanting to make sure their communities survive and prosper. Extension can play a key role in helping people create a vision across traditional geographical, sociological, and political boundaries to help their communities become a better place to live, work, and play. The Southwind Extension District has offices in Erie, Fort Scott, Iola, and Yates Center. Tara Solomon-Smith is a family and community wellness agent for the Erie office. Amanda Clasen is the community vitality agent for the Erie office. And Cassidy Lutz is the family and consumer science agent for the Yates Center office. Tara and Amanda have been facilitating community conversations with Toronto. That's a small town in southwest Woodson County. According to bestplaces.net, Toronto has a quiet charm that can't be found in bigger cities. Tara and Amanda agree that Toronto, with a population of only about 200, has a lot to offer, and the town is looking for ways to make living there even better. Amanda, just kind of cover some of the things that you've been doing in the Southwind District.
Sure. So I do a lot of connecting of the resources that the other agents already are providing in ways of healthcare work, childcare coalitions, and then economic development. We just hosted our community regional visit with the President Linton Group, and we had a good discussion on housing. That's happening in Allen County. Higher education was another discussion that we had, as well as we had a discussion with another community in Allen County that has a strong economic development work that they have been willing to share with us across the district and help get new entrepreneurs started within the district.
Housing is always an issue. Was this an issue of there's not enough or there's not enough affordable housing?
A little bit of both. There's a new facility coming in close by to our district. So a lot of our communities are worried about how to house that influx in jobs that are coming in, as well as how to work with the infrastructure of their communities to house those new occupancies.
Tara, another thing going on that you've been involved in is community conversations, and one of those was with the community of Toronto.
Yeah, we had a great turnout at our Let's Talk Toronto event. Another colleague of Amanda's and I, Leah Kay, had built relationships within that small community. And with things that we learned from our Grand Challenge for Health work, we brought the community together. Almost a third of the community came out for this conversation. And Amanda helped lead us through community capitals. We looked at strengths and opportunities. And now it helped us narrow a focus, and we have a steering group with the community that we're working with to address community health needs.
You're talking about strengths, and sometimes we don't always think about that when we're living in a community. You know, what do we really have? And that can be eye-opening for a community.
Yeah, they have a wonderful lake. That's a great outlet and a great influx to visitors. And they really value their close-knit community. That was something that came out. That was a strength. That it was rural. That was a strength to them, even though it does bring some challenges, but it was important and valuable to them.
We talk about health, and a lot of times we think that that is just your physical health, but really the health of a community is much more broad than that.
Absolutely. So Toronto has a wonderful community center, which was their old school, and they have lots of ideas on how to improve that, how to make it more, but it's already a neat hub of the community. People are there every morning having coffee. It is where they vote. So there is something about civic health out there. It is where events happen and people gather. And their vision is to make it even more, adding a playground to that hub there. Accessibility was an issue for the community as well. And so our steering committee is hoping to address some of that.
Well, that's what came out of this, right? Then was you identified some of the weaknesses, some of the strengths, and then you move forward, putting some of this into practice?
Yes. We are continuing to meet with interested members of the community and seeing how some Kansas Health Foundation funding could help them move forward in addressing some of those needs and becoming a healthier, more vibrant community.
That's really what this is all about, right? Is making these communities strong, making them to where people want to stay in the community and come to the community.
Correct. We're always looking for ways to bring people back to the communities after they come to higher education. So we're always looking for those new resources that we can bring back there and make it inviting for everybody to stay there or even come back.
Does it sound like the entire community then, because you had a third of the community show up for this, they're still engaged, they still want to see this put into place?
They are, and it's exciting. They're passionate about their community. They were thankful that we came and were interested. It's a neat town.
Tell me a little bit about the community. Where is it located within your district?
Sure. So it's in Woodson County. It is in the western side of the county. Honestly, there's more than one road into the community, but one paved road into the community. And then, like I said, there's a neat lake just outside. For such a small town, they have businesses. They have some restaurants. One boutique and restaurant is only open during the warmer seasons, so it just currently closed for the cooler season. There's a new market there that has some grocery items and provides lunch and dinner. And they have a vision for some other things, making it more of a community spot. There's a lot next to it. They were even looking into maybe a farmer's market option there, kind of a market, because it is a food desert as well as a health desert.
Is this something that can be used then in other communities? I don't want to call them a pilot project, but this is something that you're able to do in this community that could be taken to other communities?
I think so, especially how well received it was. Again, I think the important part was that our colleague Leah Kay had built relationships already, and I think that helped bring people. But we are a trusted group too and an engaged group, so I think that helped. It was fascinating to hear. Just opening up and being heard and listened to, I think, was important.
And the next step is then to follow through and see how much of this can be done and really whether there's some grants available to maybe help with the process?
Yeah, absolutely. So we're always looking for grants to kind of tag on to the foundation money that we have to offer as well. The steering group that we have, they're energetic about what they want, and they seem to have a vision for the whole town, which is nice from outsiders coming in that we don't really know what their true desire is. And so to have that leading group, they always have a vision, and they seem to be on the right track of where they want to go.
We often talk about sustainability as part of extension, and I'm assuming that comes into play here as well. Whatever you do, you want to make sure that it's sustainable?
Yes, and I think, that's always a challenge, but I think because the community members and the businesses that are in the community, I think their passion and their commitment to it, it's going to be sustainable.
Increasing the number of certified child care providers is another area the Southwind Extension District has been involved with. Cassidy Lutz is providing the necessary training and certification for child care providers and those interested in becoming child care providers to help meet the demand. Tara, first off, maybe just some background on how the Child Care Connections came about.
Sure. So there is, we all know there's a need, a child care need. Is it quality child care, and are the providers getting adequate wages, and is there enough slots for our children? And Child Care Aware put out some community action workshops, so that's how we got connected. Several of our communities were attending those workshops. One hadn't been connected yet, so we were able to be that connector, attend these community action workshops, and then come up with a plan on how we might help address that child care capacity issue.
And Cassidy, this was something that you were already working on?
Yeah, so when I joined the district back in January, I actually had an opportunity to go be trained in pediatric CPR and first aid. And that came directly from CASITO, so Kansas Child Care Training Opportunities, because, again, they recognize it is such a big need across the state. And they don't have enough training opportunities that can go to the providers when and where they need it. A lot of the times the trainings were maybe 2 hours away, and of course daycares can't just close their doors because they've got to have space for those kids to go every day. So this really allowed me to be the facilitator to go out and train those in our area that really needed that support without them having to close their doors and at the sky-high prices that some facilitators have to charge to even hold the program. So I've been lucky. Grant dollars really helped me get this going and offer it to those in our communities.
Community-wide, what was the response? What type of interest did you see?
Yeah, so we actually had a child care community conversation, and based off of that, all the child care providers were extremely excited. Some definitely called me up the next day and were wanting to be on my waiting list, and I said, sure, we'll get you in whenever. So it was definitely a need that we saw, and I'm already starting to meet that.
So how does it work from the training standpoint?
Yeah, so for me, it's really awesome because of Cassidy. I got all of the training materials that I need, so all the mannequins, all the replacement parts, all the handbooks. I also can give them the e-cards that they have to prove for their certification, all for free. And so they offer grant opportunities that basically refunds me to allow them to take the training for free, be certified, and then they're good for 2 years. So then they would contact me. I would set up a time that works best on both my schedule and their schedule. So for instance, the one in Erie, I actually went to them and we did it in their daycare center, which was awesome. I was able to train 8 people in one big setting, so one full day instead of having to break it apart and have them close doors multiple days in a row.
So could this be people who are wanting to open a daycare center themselves, or is this people who are already working in childcare?
So it's actually both, and that's really exciting because not only am I helping those providers that already have their doors open, but with the push in childcare, I'm also helping those that are wanting to get into it and help them address the needs in their community, because we're hearing more people need to do childcare, but they need to be able to have the trainings in order to start that childcare facility. So it's both.
We were talking before on the fact that there is a lot that goes into operating a childcare center, whether it's in your home or a standalone facility, and just a lot of things that they really need to know, a lot of rules, a lot of regulations.
Yeah, for sure. And we have great connections through the state that have been coming to all these community conversations and some of the coalition work that Tara has been involved in. So Tara might be able to speak to some of that as well.
Yeah, it is quite a process, and it's not always a fast process. I know the state is working on hopefully streamlining that a little bit. Something else that K-State Research and Extension has, they have a partnership with Kansas Department of Health and Environment, and we're also able to provide ServSafe training to child care providers, which they get their KDHE hours. They are required to have so many every single year. And I recently did one, went to them on a Saturday. You know, and me, I kind of felt bad. They're giving up their Saturday, and they're like, no, thank you for giving up your Saturday, because this is when we can do that. And they got that health and nutrition hours. That was a requirement.
So that would be on the food side of things?
Yes, that's correct. Especially since our youth are more vulnerable to foodborne illnesses. So it's definitely good to have that foundational knowledge on how to serve food safely.
This is something that we have identified as a need, and as part of this, we're really kind of meeting 2 needs here, because we're finding the child care that people need, but we're also allowing more people to get into the workforce.
Oh, absolutely. They are the workforce behind the workforce, right? And part of our coalition work is elevating the child care business and role as well.
You cover 4 counties, so are you going county to county? You're just picking a spot and hoping that people can come to that? It sounds more like you're going to them.
Yeah, so we've really tried to push out this information. I believe every county that we serve in, it's kind of just on who's in the counties and who has that interest and that need. So there's definitely a glaring need in all the counties, but some stand apart and some have gotten grants because of that, and that's kind of where we've been focused so far. But I think I can speak for probably Tara and myself. We're eager to take our trainings anywhere and everywhere that child care providers need. I know I'm actually going to be providing a training to 2 individuals out of Parsons. They're actually coming all the way up to me to host it in the Iola office. So we're not just restricted, I don't think, to our counties that we serve, because we're really here to help meet the needs of Southeast Kansas.
Yeah, we're all better together, and so we may have that experience in some subject matters that others don't.
That's Tara Solomon-Smith, the Family and Community Wellness Agent for the Southwind Extension District's Erie office, and Cassidy Lutz, the Family and Consumer Science Agent for the Southwind District's Yates Center office. We also heard from Amanda Clasen, the Community Vitality Agent for the Southwind District's office in Erie. More information about community conversations is available at Extension offices across Kansas. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.